Welcome back to Great Day Washington. As the baby boomer population ages, experts say there will be more Americans with arthritis.
And the Centers for Disease Control and Prevention estimates 67 million Americans will have arthritis by the year 2020. But you don't have to live in pain.
Here now is Dr. M. Scott White, D.C. of New Life Laser. Welcome again, my friend.
Welcome back to Great Day Washington.
Thank you. It's good to be here. Hey, before we get started, I just wanted to thank everybody here at Great Day Washington. You know, we've been able to reach thousands of people. I don't know how many times I've been on, but with these shows, thousands of people that we might not have been able to help otherwise. So I wanted to thank everybody involved.
Oh,
and Marquette,
you're welcome. Yes.
You are wonderful.
Thank
You're
you.
Awesome. You're amazing, and of course beautiful.
Keep talking, I'm listening.
And intelligent.
Mm-hmm.
And Chris. Well, Chris, you're Chris, and that's special too.
I hear that a lot. Never knew what the heck it meant. I understand now. It has meaning.
So anyway, we do appreciate, because you guys are helping us help people get out of pain. So.
And Dr. M. Scott White, D.C., you say that people are mostly experiencing pain in their knees and their hips.
Well, here's the thing. We use a robotic deep tissue laser. Now, this laser is not a cutting laser. It does no tissue destruction. It doesn't hurt. There's no downtime. It's transdermal. It goes about 5 inches into the body, draws out inflammation like doing a steroid shot or taking a pain pill or anti-inflammatory, but no drugs and no needles. And so the cool thing about it is it not only helps people feel better, but it can actually regenerate tissue. And we talk about knees and hips. You know, as we get older, we want to stay active, right? The problem is sometimes those golden years aren't so golden. People get to where they can't move around well with their knees, their hips. And you know what? The medical alternatives aren't necessarily great. You know, one thing I want people to know is there is an alternative. I mean, we can remove knee pain, hip pain very well with this, like doing a steroid shot, but no negatives. You know, we've got the pictures of degenerated hips, degenerated knees. The reason knees and hips degenerate is that there's not a good blood supply there. When God created our bodies, once we reach the age of 6 to 8 years old, the blood supply dries up in those areas. So if you cut yourself or you break a bone, blood gets to it, the platelets in the blood turn on the stem cells, and everything knits back perfectly, but not in knees and hips. So if you're an athlete or you, through repetitious injury to the knees, maybe your work or whatever, you get arthritis in your knees and hips, what happens is because there's not a good blood supply, it can't heal on its own. So the exciting thing about the robotic deep tissue laser is it can put blood supply back into the damaged cartilage. So what we're doing is pain relief, yes, thank God for that, but also what it does is causes, once the blood infiltration's in there, causes the stem cells to turn on so that cartilage can actually get better. So you're stopping the pain, but you're actually doing something to reverse the process, slow down the arthritis, and even cause healing. So like 40 to 70% of our patients' knees and hip problems, actually about 86 to 92% of people do better, but about 40 to 70% better. And that's incredible with no drugs, no surgery. So.
Wow. So it's our body healing our body.
That's correct.
That means no after effects.
Yeah, and the whole idea is your doctor has probably told you, well, you have arthritis and there's nothing we can do about it. Listen, knee replacements and hip replacements, it's like right now it's like a plague. I mean, what's happening with the medical community is once you get to a certain age, you know, over 65 years old, and you have a degenerated knee or hip, they're wanting to put a new one in you, you know, but natural is always better. And this is an alternative. And you know, a lot of people can't have knee replacements and hip replacements. Maybe they've got a heart condition, or maybe they've got diabetes or something that limits them, or maybe they're young. If you're 35 years old or 45 years old, you don't want to do a knee or hip replacement because you'd have to do another one, you know, down the road. So a lot of doctors will say, well, put up with the pain until you can't stand it anymore, or get these steroid injections. Every time you get a cortisone injection in a hip or a knee, you're actually furthering the degeneration. You're accelerating it.
Well, you know, doctor, I know that Washington, you're in pain because every time you're on the show, hundreds of people call and say, where do I get more information? So where do we go for more information? Let's tell them right now.
Okay, what we do is we call 1-888-PAIN-FREE. That's 1-888-PAIN-FREE. Now, over the next 2 hours, you can call that number and you can get a completely no-charge first visit. Now, we have 5 area locations. We're opening a 6th. There's Woodbridge, Bethesda, McLean, Fairfax, and Lansdowne. Okay, so when you call, tell them where you live. They'll direct you to the closest clinic. And listen, here is something that I decided to do on the way over here this morning. That first visit is completely no charge. Bring your x-rays, bring your MRIs, anything you have, medical history.
You have to mention Great Day Washington, though, to get this deal.
You have to do that, but
Right.
here's something even better. Probably 60% of the people that come in with a knee problem have both knees, unfortunately. So what happens is after that no-charge visit, and you see the results, and you want to do more treatments, we're going to give you a twofer. So basically, if you are one of those unfortunate people with both knees, if you mention Great Day Washington, you have to tell them when you call to schedule the appointment, okay? You can't spring it on them when you get to the office. But tell them...
I was watching Great Day Washington. That's how you lead in.
And say, I've got 2 bum knees. What you can do is you can, if you actually do the treatment, you're going to actually get both knees for the cost of one.
More bang for the bum.
Thank you
knees.
so much. Getting Washington out of pain.
Good.
And
Thanks,
thank you,
Doc.
guys.
Yay, thank you. Good
We
job.
like laser.
There goes that pain. I can see it go away right now.